What is COVID-19, and how can I protect myself from it? COVID-19 is a new virus called Severe Acute Respiratory Syndrome Coronavirus 2, SARS-CoV-2, which is responsible for a disease that first appeared in China in 2019. The disease caused by this virus is called coronavirus disease 2019, COVID-19. In March 2020, the World Health Organization declared COVID-19 a global pandemic. Public health organizations, including the Centers for Disease Control and Prevention, CDC, in the United States and the World Health Organization, WHO, are actively monitoring the pandemic and providing updates on their websites. These organizations issue recommendations to prevent the spread of the virus causing COVID-19. How does COVID-19 spread? Data has shown that COVID-19 primarily spreads from person to person through close contact. The virus spreads through respiratory droplets that are expelled when an infected person coughs, sneezes, breathes, sings, or talks. If someone nearby inhales or gets these droplets on their mouth, nose, or eyes, they can become infected. In some cases, it is possible for COVID-19 to spread when a person is exposed to small droplets or aerosols that remain suspended in the air for several minutes or hours. This is known as airborne transmission. The virus can also spread if you touch a surface contaminated with the virus and then touch your mouth, nose, or eyes. However, the risk of transmission through this route is low. COVID-19 can be transmitted by individuals who are infected but do not show any symptoms. This is called asymptomatic transmission. It can also spread from individuals who are infected but have not yet developed symptoms. This is called presymptomatic transmission. It is possible to be infected with COVID-19 multiple times. What are the symptoms of COVID-19? Symptoms of the novel coronavirus disease 2019, COVID-19, may appear 2 to 14 days after exposure. This period following exposure and preceding the onset of symptoms is called the incubation period. It is possible to spread the COVID-19 virus before you show symptoms. Common signs and symptoms include fever, cough, fatigue. Early symptoms of COVID-19 may also include loss of taste or smell. Other symptoms may include shortness of breath or difficulty breathing, muscle aches, chills, sore throat, runny or stuffy nose, headache, chest pain, red eyes, conjunctivitis, nausea, vomiting, diarrhea, skin rash. This list does not encompass all symptoms. Children may experience similar symptoms to adults, generally with milder illness. The severity of COVID-19 symptoms can range from very mild to severe. Some people may only experience mild symptoms, while others may have no symptoms at all yet still transmit the disease, asymptomatic transmission. Symptoms such as shortness of breath and pneumonia can worsen in some individuals approximately 1 week after symptom onset. Some individuals experience COVID-19 symptoms for more than 4 weeks after diagnosis. These health problems are sometimes referred to as post-COVID-19 conditions. Some children may develop multisystem inflammatory syndrome, a condition that can affect multiple organs and tissues, several weeks after being infected with the COVID-19 virus. In rare cases, some adults may also develop this syndrome. The risk of experiencing severe symptoms from COVID-19 is higher in older adults, and the risk increases with age. The severity of the disease is also heightened in individuals with certain underlying medical conditions. Specific medical conditions that increase the risk of severe symptoms from COVID-19 include serious heart conditions, such as heart failure or coronary artery disease, cancer, chronic obstructive pulmonary disease, COPD, type 1 or type 2 diabetes, obesity, high blood pressure, smoking, chronic kidney disease, sickle cell disease or thalassemia, Weakened immune system from solid organ transplant or bone marrow transplant. Pregnancy. Asthma. Chronic lung diseases, such as cystic fibrosis or pulmonary hypertension. Liver disease. Dementia. Down syndrome. Weakened immune system from a stem cell transplant or HIV infection or certain medications. Conditions related to the brain or nervous system, such as stroke. Substance use disorders. This list does not encompass all symptoms. There are other medical conditions that may increase the risk of severe symptoms from COVID-19. Can you prevent getting infected with COVID-19? The U.S. Food and Drug Administration, FDA, has authorized the emergency use of certain COVID-19 vaccines or has approved them. The FDA has authorized the use of the Pfizer-BioNTech COVID-19 vaccine, now known as Comirnaty, to prevent COVID-19 in individuals aged 12 years and older. The FDA has also granted emergency use authorization for the Pfizer-BioNTech COVID-19 vaccine for children aged 6 months to 11 years. The FDA has authorized the use of the Moderna COVID-19 vaccine, now known as Spikevax, to prevent COVID-19 in individuals aged 18 years and older. The FDA has also granted emergency use authorization for the Moderna COVID-19 vaccine for children aged 6 months to 17 years. The FDA has also authorized the use of the Novavax COVID-19 vaccine to prevent COVID-19 in individuals aged 12 years and older. One of the vaccines. Can I travel? If you're planning to travel, check the necessary travel measures and follow precautions when visiting public places. You may also want to consult a doctor if you have underlying health conditions that make you more susceptible to respiratory infections and their complications. What should I do if I suspect I have COVID-19 or have been diagnosed with it? If you experience symptoms of COVID-19 or have been exposed to the virus, contact a doctor for medical advice. The doctor is likely to recommend getting tested for COVID-19. If you experience emergency warning signs of COVID-19 such as difficulty breathing, seek medical care immediately. If it is necessary to go to the hospital, call ahead so that the doctor can take necessary precautions to prevent others from getting exposed to the virus. When should I see a doctor? If you experience symptoms or signs of COVID-19 or have been in close contact with someone diagnosed with COVID-19, call your doctor immediately for medical advice. The doctor is likely to recommend getting tested for COVID-19. If you experience emergency warning signs of COVID-19 such as difficulty breathing, seek medical care immediately. If it is necessary to go to the hospital, call ahead so that the doctor can take necessary precautions to prevent others from getting exposed to the virus. If you have emergency warning signs of COVID-19 and its symptoms, seek medical care immediately. These emergency signs and symptoms may include difficulty breathing, persistent chest pain or pressure, inability to stay awake, new confusion, bluish lips or face. Severe symptoms may not be limited to this list. Inform your doctor if you are an older adult or have underlying medical conditions such as heart or lung disease, as you may be at higher risk of experiencing severe symptoms due to COVID-19. Disease complications. Although most people with COVID-19 have mild to moderate symptoms, the disease can cause severe medical complications and can be fatal for some individuals. Older adults or those with pre-existing health problems are more susceptible to severe illness when infected with COVID-19. Complications may include pneumonia and respiratory issues, multi-organ failure, heart problems, acute respiratory distress syndrome, which causes a decrease in the amount of oxygen reaching your organs, acute respiratory distress syndrome, blood clots, severe kidney injury, additional viral and bacterial infections. Follow the following precautions to avoid spreading COVID-19. 1. Stay home and avoid going to work, school, and public places, except for medical care. 2. Avoid public transportation, taxis, and rental services. 3. Wear a cloth face mask when around other people or pets. 4. Wash your hands frequently with soap and water for at least 20 seconds. 5. Isolate yourself as much as possible from others or pets while at home. 6. Use a separate bedroom and bathroom if possible. 7. Avoid sharing dishes, cups, bedding, and other household items. 8. Ensure regular cleaning and sanitization of frequently touched surfaces. Please note that COVID-19 guidelines and recommendations may vary depending on your location, so it's important to refer to official sources and local health authorities for the most up-to-date information.